Okay, let us study the skull bone. The skeleton of the head is called as the skull. When we use the term skull, it means it also includes the lower jaw, which is also known as the mandible. The skull can be divided into two main parts, the calvaria, also known as the brain box or neurocranium. This calvaria, the upper part of the cranium, it encloses the brain within its cavity. It consists of skull cap, this is known as the skull cap, and it consists of the base of the skull. This portion is known as the base of the skull, this entire part. So this is the calvaria. The second part is the facial skeleton. This is known as the facial skeleton, also known as the viscerocranium. The rest of the skull which form the facial skeleton, and it also includes the mandible. So this is the facial skeleton, and this is the calvaria, consists of brain box, vault, and the base of the skull. Now let us see the bones of the skull. The skull having total 28 bones, calvaria and the facial skeleton, both of them, they consist of 14 bones. So in calvaria, the paired bones are, here we can see, this is the anterior side. So this one is the parietal bone. Here we can see the parietal, it is paired. Then on the both the side, temporal. This one is the temporal bone. Here this bone is the temporal bone, and it also consists of malleus incus and the stapes, which are the ear ossicles. The unpaired bones are, this one is the frontal, this one is the frontal, then the occipital, this is also unpaired bone, this one is the occipital bone, then this one, this is the sphenoid bone. Here we can see this is the sphenoid bone, and here this one is the ethmoid. So these are the unpaired bones of the calvaria. Now bones of the facial skeleton. So there are total 6 paired bones are there. Here this one is the nasal apertures. On each side of the nasal aperture we can see the maxilla. Just lateral to the maxilla, the bone which form the cheek, or also known as the cheekbone, this is the zygomatic bone. They are also paired. Then on the upper part of the nasal aperture, here we can see these two are the nasal bone here. Then on the medial side of the orbit, here we can see the small quadrilateral bone. This is the lacrimal bone. Then here we can see this is the palatine bone. We can also see it from the below. This is the palatine bone, and another one is the inferior nasal concha. This is the inferior nasal concha. This is also a paired bone here and here on the both the side, inferior nasal concha. The unpaired bone is this one, mandible. Here this is the mandible, and this one is the vomer. Mandible and vomer, these two are unpaired bones. So total 28 bones within the skull. Now joints within the skulls, the bones of the skull, they are mainly joined by the sutures. There are only 3 synovial joints are present within the skull. The 2 joints are between the ear ossicles, and one is the temporomandibular joint. Other joints are the sutures, and some of them are primary cartilaginous joint. Now anatomical position of the skull. The skull can be studied by considering any one of the 2 planes. One is the Reed's base line. It is the orientation line which passes the inferior orbital margin here. This one is the inferior orbital margin from the center of external acoustic meatus. This one is the external acoustic meatus. So one horizontal line which passes from the inferior orbital margin to the center of external acoustic meatus. This line is known as the Reid's baseline. You can study the skull by keeping this 2 point in a one horizontal plane. Another one is the Frankfurt's horizontal plane, the plane of the orientation. It is obtained by line joining from the infraorbital margin to the upper margin of the external acoustic meatus. From the infraorbital margin to the upper margin of the external acoustic meatus. So skull can be studied by keeping it in either of these two line of orientation. Now peculiarities of the skull bone. The base of the skull, it ossifies in the cartilage. This portion, this part, the base of the skull, it ossifies in the cartilage, whereas the skull cap, this one, the skull cap, it ossifies in the membrane. Now the next peculiarities, it is at the time of the birth, the skull is formed by only one table of the bone. After 4 years, it formed by the two tables are formed, and there is the diploid is present in between the two table. Here we can see the diploid are the space which contain the red bone marrow, and they forming the RBCs, WBCs and the platelets. So these are the two tables. In between there is a red bone marrow or diploid is present. Diploid are space which contain the red bone marrow. Now another peculiarity is at the birth, the four angle of the parietal bone, they are having a membranous gap and they are known as the frontalis. The function of this frontalis is that it helps in overlapping of the bones during vaginal delivery if required, and they also allow the skull to increase in the size after birth for housing the delicate brain. So frontalis, there are four frontinalis present at each angle of the parietal bone. Another peculiarity is that some bones like maxilla, frontal bone, they having air cells within them, and because of the presence of the air cells within them, they are known as the pneumatic bones. The function of this bone are they reduces the weight of the skull, they maintain the humidity of the inspired air, they give resonance to the voice, and they may get infected, which resulting into the sinusitis. Next is the next peculiarity is as I already told that the most of the bones of the skull, they are united by the sutures. Another peculiarity is that the skull having a small foramen for the opening of the emissary veins. The emissary veins are the veins which connect the intracranial venous sinuses with the extracranial veins. So here one clinical is there that if there is infection outside the cranial cavity, through the emissary vein it can be reached up to the intracranial venous sinuses. The function of this emissary vein are they relieve the raised intracranial pressure. So emissary veins, these are the small foramina for the emissary veins. Then the last peculiarity, this portion, here we can see this part, this portion, the petrous part of the temporal bone, this one, the petrous part of the temporal bone, it is the densest bone of the body and it contains the ear ossicles. It contains the inner ear and middle ear, and within the middle ear there is a ear ossicles which has the malleus incus and the stapes are present, and these ossicles are also known as the bone within the bone, and they are fully formed at the time of the birth. So these are some peculiarities of the skull bone. Method of the study of the skull bone. Skull can be studied as a whole. So, and it is also can be studied by individual bone. Mostly we are studied as a whole. So when you see the skull from above, from the superior view, this is known as the norma verticalis. When you study the skull from the anterior side, it is known as the norma frontalis. When you study the bone from the posterior side, it is known as the norma occipitalis. This is the norma occipitalis. When you study the bone from the lateral side, it is known as the norma lateralis. And when you study the bone from the inferior side, it is known as the norma basalis. So, skull can be also studied by its interior. So, this is the interior of the skull, and it having a natural 3 division: anterior, middle and posterior cranial fossa. So, this is about the skull bone. The next video is about the norma verticalis and norma occipitalis. Thank you.